Hi guys, so today we are going to study about the glycogen storage diseases. Glycogen storage diseases. First of all, we are going to study about the basics. Okay? सबसे पहले क्या करना है? सबसे पहले घबराना नहीं है, ठीक है? So let's study the basics. What are these? What are glycogen storage diseases? These are metabolic defects. What are these? These are metabolic defects of glycogen storage, synthesis, and degradation. Okay. So what are glycogen storage diseases? These are metabolic defects of glycogen storage, synthesis, and degradation. Now, what is metabolism? What is metabolism? Metabolism is chemical reactions required by body to convert food into energy. Food into energy. जो भी खाना हम खाते हैं वो इवेंचुअली एनर्जी में कन्वर्ट होता है. तो एनर्जी में खाने के कन्वर्ट होने की प्रोसेस ही मेटाबॉलिज्म है. ओके, लेट्स नो व्हाट इज ग्लाइकोजन देन. व्हाट इज ग्लाइकोजन? Glycogen is a carbohydrate and the storage form of glucose. Okay. So what is glycogen? Glycogen is the storage form of glucose. So let's understand this simply. This is glucose. Okay. For example, 50% of glucose is used in energy or the demands of body. Okay. So what happens to this 50% glucose? This 50% glucose will get converted to glycogen. Okay. So यहाँ तक clear है सबको? Isn't it simple that some of glucose is getting converted to the energy and some of glucose is getting converted to the glycogen? And what is glycogen? Glycogen is the storage form of glucose. So what does this mean? This means that our body will use glycogen whenever there will be the shortage of glucose. Okay. It is also known as GSD or glycogenosis. Okay. Characterized by normal or abnormal glycogen getting deposited in the tissues. Okay, so यहाँ तक clear है? What is happening here? Normal or abnormal type of glycogen is getting deposited into tissues. So here one by one we will understand that why this glycogen is being deposited into the tissues and why it is not being metabolized. Okay, to understand this, first of all we need to understand the types of glycogen storage diseases. So there are 8 types, 0 to 7. Okay, 0 is defect in glycogen synthase. 1 is von Gierke's disease. Okay. Second is Pompe's disease. Third is Cory's disease. Fourth is Anderson disease. Fifth is McArdle's disease. Sixth is Her's disease. Okay, Her's disease. And the seventh is Taure's disease. Okay, so these are 8 defects of the glycogen storage diseases. We will study them one by one. Let's begin with type 0, glycogen synthase defect. This is defect in glycogen synthase enzyme. That means glycogen synthase enzyme ही खराब है. And what does it lead to? It leads to the deficiency of glycogen. So now let's understand what will happen when there will not be glycogen. Okay? When do we need glycogen? We need glycogen जब body के पास glucose नहीं होता, right? Glycogen required in the absence of glucose. So अब हमारे पास glycogen भी नहीं है. There is no glycogen. No glycogen. What will happen? What will happen? Hypoglycemia, right? No glucose, no glycogen. So what will happen? Hypoglycemia. So body will try to use ketone bodies, right? This will eventually lead to ketonemia. Okay. So in glycogen synthase defect, there will be hypoglycemia and ketonemia. And other symptoms will be the mix of other glycogen storage diseases, which we will study later. Okay. So now let's begin with the type 1 GSD. Type 1 GSD. Von Gierke disease, right? Von Gierke's disease. Why this is called Von Gierke's disease, do you know? Because Von Gierke first discovered it in 1929. Okay. And what did he discover? He discovered that glucose 6-phosphate is being accumulated in his patients who were children basically. Okay. So accumulation of glucose 6-phosphate. This glucose 6-phosphate was getting accumulated because of the deficiency of enzyme glucose 6-phosphatase. Okay. So the enzyme deficient in the von Gierke disease is glucose 6-phosphatase. This enzyme was necessary for the final steps of glycogenolysis and gluconeogenesis, essential for final steps of for the conversion of glycogen to the glucose. So what happens next? Now your body needs glucose and there is no glycogen, there is no storage, no backup, right? So eventually your body will go into hypoglycemia. There will also be lactic acidemia. Let's understand how this lactic acidemia will occur. So what happens is this increased glucose 6-phosphate will try to go to glycolytic pathway. Glycolytic pathway. Why? Glucose 6-phosphate बढ़ा हुआ है तो कहीं तो उसे जाने के लिए कोई तो जगह चाहिए, right? So it will try to go to the glycolytic pathway. There it will get converted into pyruvate. This pyruvate will get converted into lactate and eventually lactic acidemia will occur. Next is hyperlipidemia. There is no glucose, so body will try to use the fats, right? Fats will get converted into energy. So increased levels of free fatty acids in the blood. Next is hyperuricemia. We will not get into the details of this, but I'll tell you what happens. So what happens here is this increased glucose 6 phosphate will try to enter into pentose phosphate pathway. That pentose phosphate pathway will eventually increase the metabolism of purine nucleotides, which will eventually increase the level of uric acid in blood, leading to the hyperuricemia. This glucose 6 phosphate will enter into this pentose phosphate pathway, increasing the metabolism of purine nucleotides into uric acid, increasing the levels of uric acid in blood. So, what are the symptoms of the von Gierke disease? Hypoglycemia, lactic acidemia, hyperlipidemia, and hyperuricemia. Management. Management usually revolves around the managing blood glucose levels and manage metabolic defects to prevent complications. So, what did we study? हमने पढ़ा glycogen synthase defect. Glycogen synthase defect में glycogen ही नहीं बन रहा है. And what does it lead to? It leads to hypoglycemia and ketonemia. And then we have studied von Gierke disease, which is the deficiency of enzyme glucose 6 phosphatase. And what are the symptoms of its deficiency? The symptoms are hypoglycemia, lactic acidemia, hyperlipidemia, and hyperuricemia. And how do we treat it? Mostly by managing the blood glucose levels. So, we will study the next types of the glycogen storage diseases in our next video. Thank you.